Yeah, hello, this is Arturo Jimenez from Micro 4100, and this is my group's case studies presentation. So, to start off, what is a virus? While a virus is usually considered an infectious molecular parasite that requires a host cell to replicate. Examples of hosts are like animals, plants, bacteria, and even humans. Viruses have always been around humans and are known to be all around the world. It was just recently in the past 200 years where their presence actually discovered. Like all life on Earth, there are thousands of different types of viruses, and typically when a new virus is discovered, they are categorized in the Baltimore classification. This class has this classification has six classes, and viruses are placed in one of those classes based on their genome and mRNA synthesis. What mainly separates viruses from other known life forms is that they replicate via self-assembly. And how they do that is by infecting hosts and using their machinery. Overall, viruses are a unique class of organisms. In these 17 case studies, each was a recording of a virus infecting somebody and causing specific symptoms. For each of these cases, an analysis was performed to gain a general understanding of these viruses.
All right, so first up we have the case study 1, which is about the enterovirus. Okay, the enterovirus is a positive single-stranded RNA virus that's part of the Piconovirdae family. It's named after the way that the virus is transmitted, which is actually through the intestines. Enteric, it means intestine. So the genus of the virus is actually the enterovirus, and it has 71 known variations of it that affect humans. And at first they were giving them names, but there was so many of them that they just based it on their VP1 caspid region. So it gets a numerical name, just like the polio viruses. They're named the human enterovirus C species, and all the polio viruses are named under that species themselves. So the enterovirus is actually very easy to contract. It's just as easy to get as like a common cold. And it also, the symptoms of it very range in severity. You can have symptoms as in like the case study, the young girl, that she appeared really lethargic, and she had a really high fever of 39 degrees Celsius, and they took her back to the doctor the second time, she had a very high white blood cell count. She also experienced like some vomiting later on in the evening, and like swollen glands in her neck. So it very much exhibits like a common cold. That's why like testing for it can be as simple as getting like a swab of inside the cheeks or a nasal swab, anything from any like respiratory swabbing, or it's mostly done through PCR of the cerebral spinal fluid. And that's basically how it would get diagnosed because it's so similar to a common cold. All right, next is case study 2 on the Norwalk virus, which is a single-stranded RNA virus, and it belongs to the Calciavirdae family. So the Norwalk virus is actually the original name of it because there was a huge outbreak in a school in Norwalk, Ohio. It's much more commonly known as the norovirus, and it is very, very highly contagious, and the symptoms are very severe diarrhea, vomiting, stomach pain, fever. And it's mostly transmitted through contaminated food contact, coming from like fecal matter, or if somebody vomits, and then that gets transmitted through food, or through contaminated water. It's very, very easy to contract. And the reason for this is because the virus itself is non-enveloped, so it has no lipid cover. So basically what that means, it just needs the capsid and the proteins of the host cell to replicate itself. And since it has no envelope, it also means very, very resistant to outside stressors like disinfectants or heat that we would normally use to clean surfaces with. So this is, in this case study, a group of adults all got sick after they left a restaurant a couple days later. And this very much resembles the rotavirus, but with the rotavirus, it's much more intense in young children. Adults can also get sick, but the symptoms are way more mild as opposed to the norovirus. And also the rotavirus, it lasts for several days as opposed to this virus, the Norwalk virus. It really only lasts for 24 hours, which is what happened in this case study. And one of the main questions of the case study was like, how do you prevent something like this? And it's really just a matter of like making sure employees are following proper hand washing techniques, because in this case study, it's most likely that the adults were sick because of improper hand washing from an employee that was making the food, whether it's returning from the restroom or it's whether the employee was sick and still at work. So if they were sick, it should be that employees are staying home while they exhibit symptoms, as well as up to a few days after they exhibit the symptoms, because they still can carry the virus. Okay, next is case study 3. It is the dengue virus. The dengue virus is a positive single-stranded RNA virus. It's in the family of Falviridae and in the genus of Falvirivirus. And it has most recently been known as one of the worst mosquito-borne human illnesses. And its symptoms are very well known to cause like a rash, like in this case study. This man and his child, they went to a tropical country, which is where these viruses are. You don't really see them too much in the US. You see them more in tropical countries because they are carried through mosquitoes. So this 27-year-old man and his young son went to Malaysia, and they came back, and 5 days later, they started experiencing rashes, joint pain, high fevers, and the son was exhibiting flu-like symptoms, which is how the dengue virus presents itself in children. And the son also did become unresponsive and had a lot of bruising later on. So the dengue virus is very well known to cause severe illness when it becomes dengue fever. And this is a hemorrhagic fever, and which is what the son started to develop. The son in this case study started to develop. And what happens is when the dengue virus enters the cell and it starts to assemble the RNA replication in the intercellular components, what it does is it buds into the ER, the endoplasmic reticulum, using the ER as an envelope as it buds out, and this causes ER stress and apoptosis of the cell, which allows the virus to just replicate and spread very quickly. And so with the hemorrhagic fever, what it does is it causes like the capillaries, the tiny blood vessels, to burst. And the son in the case study here, he started to exhibit PDJ, which is the capillaries bleed underneath the skin, which they look like a rash, but when you press on them, they don't lose their color, they remain. And that's because it's almost like a bruise, which is also what the son was experiencing. He was experiencing severe, or he was just bruising very easily. And because the tiny blood vessels were bursting underneath his skin, which is what happens with the viral hemorrhagic fever. Normally, this is really only happens due to like prolonged stress or medications, and clearly like the son didn't have any of those symptoms. So the only other thing it could have been was the virus was causing the bleeding. And we have case study 5, which is the rabies virus. The rabies virus is a negative single-stranded RNA virus in the family of the Robotoviridae and in the genus of Alyssa virus. This virus is notorious for, once its symptoms start to appear, it's usually always fatal. Some people have survived before in the past, but it's very, very rare that once symptoms onset from rabies that someone will, a human will survive from it. This is mostly transmitted through a bite from a rabid animal. And what this virus does is it specifically targets the central nervous system. So the incubation period for this virus is very long. Like in this case study, the 11-year-old boy was bitten by a dog in India 5 months prior to showing symptoms. And the reason for this is because the virus has to move from the site of the infection to the brain. And the way that it does this is it'll say, like in this case study, the boy was bitten in his finger. And so it's near the muscle on the finger. The virus will spread through the axon to the terminal, to the end terminals, and will be passed from neuron to neuron until it reaches the brain. And then once it does reach the brain, you will start to see an onset of symptoms. And then at that point, treatment, there's not really any treatment that helps once symptoms are onset. There is treatment to help the symptoms kind of subside a little bit, but it's usually always fatal once these symptoms appear. If a bite is caught early on, say the boy had gotten bit and mentioned something to his, had said something to his parents nobody had known in this case study, they could have taken him to the doctor, and usually it's just caring for the wound. You got to wash it with soap and water daily, and then you start a round of rabies vaccines. So the first one is very fast acting, and it contains the rabies immunoglobulin, the rabies immune globulin, and it's usually injected near the site of the bite. And so that is the first one, very fast acting. And then for the next 14 days, you get a round of 4 more injections of the rabies vaccine, which basically just helps the body recognize the rabies virus and will allow your body to recognize it and fight it off. There is, however, something interesting called the Milwaukee Protocol, which has been used a few times where patients have lived once symptoms have onset. And what it is like they induce a coma in the patient, so they lower the brain activity, and then inject the rabies virus, hoping that the immune system will focus on making sure that the body is producing very accurate antibodies to help fight off the virus. And then the induced coma just helps lower the brain activity in hopes that the immune system will produce the antibodies as quickly and efficiently as possible. But the vaccine itself for rabies, so the rabies virus is actually made up of like the 5 open reading frames. There's the nucleoprotein, the phosphoprotein, the matrix, the glycoprotein, and the large structural protein. And the vaccine is very well known to target the G protein, that's the glycoprotein, because it has been most known to produce the most antibodies. But if it's not caught in time, then the symptoms are actually very unique to the virus. They start off, as like weakness, fever, headache, and then they worsen to things like anxiety, hallucinations, fear of water, just very abnormal kind of aggressive behavior, salivation, just delusion, and then once those symptoms are onset, it is usually fatal. So it's important to start the rabies vaccine as soon as possible.
My name is Alexander Jimenez, and I'm going to be covering case study 4, 6, 7, and 8. And now beginning with case study 4, it is rubella virus. And now this virus is part of the genus Rubivirus and from the family Togaviridae. Now rubella is a positive sense RNA virus that is transmitted via direct contact and aerosol droplets. The virus is also accompanied with mild skin rashes and joint illness like arthralgia and arthritis, which in this case, for this case study, that's exactly the symptoms that the patient had. The symptoms appeared shortly after the trip due to the complexity of disease, and according to the basic virology textbook, these cells don't see any structural change or shutoff of host cell functions until a long time after infection, giving the indication that it um, does take a while for symptoms to start popping out. Now, some precautions the patient could have taken would be washing his hands frequently and being very careful around people that are sneezing or coughing. Overall, maintaining proper hygiene is already effective enough, but there could be extra measures taken, like wearing a face mask as well. The infection was most likely transmitted through contact with someone who was infected via aerosol droplets or direct contact. And this transmission could be made easier because there are some people that could be infected with rubella and be asymptomatic without knowing that they have the disease and then transmit it to other people. And the ones who are at risk for a serious outcome of the disease are adults and fetuses. It is more fatal to fetuses though. The immunization of this disease is important because it can easily pass the blood placenta barrier, and this can cause fatal miscarriages for mothers. And if the child ends up surviving, they could end up having severe developmental issues. Now, for case study 6, it's going to be respiratory syncytial virus. Now, RSV is a respiratory infection under the genus Pneumovirus, and that genus is under the family Paramyxoviridae. Now, this negative sense RNA virus can cause laryngotracheal bronchitis, and this leads to swelling in the trachea and causes the barking cough that was seen with the patient in this case. And a specific or common name for these symptoms can be bronchiolitis, which usually occurs to children that are less than 2 years of age, especially in this case. Other agents that can cause the same clinical presentations would be parainfluenza virus, as it also has similar symptoms as RSV. Generally, lab tests are not needed to get the diagnosis, and that's because usually the diagnosis could be made with just the how the symptoms are presented. But to be 100% sure, a nucleic acid test can also be performed, as it can help diagnose respiratory viruses. Any possible treatments can be with supportive oxygen, monitoring fluid and nutrition through gastric tube or intravenously, and other treatments like nebulized hypertonic saline can also be used, but the results often vary, and I wouldn't recommend that treatment. This child was contagious when the symptoms of the coughing started to become more and more prevalent, as that's how the disease gets transmitted. Case study, it's influenza virus, and this virus is part of the genus influenza virus, and this genus belongs to the family or Orthomyxoviridae and is associated with respiratory and or infections, just like RSV. A differential diagnosis could be respiratory syncytial virus, as both of them have the same symptoms that involve coughing and throat infections. Another diagnosis could be the common cold as well. Often it's going to be the symptoms are going to be much more mild for a common cold. Now, to confirm the diagnosis, an influenza A and B rapid lab test can be performed, which has results as fast as 15 minutes. And in terms of treatment, Tamiflu is found to be effective due to stopping enzymatic activity of the virus, which prevents budding. This will be very effective in treatment of the patient as it works for both influenza A and B, and it is not recommended for the family members who are still not infected as it won't do much to them. The patient became very contagious once the cough symptoms became prevalent, since the virus is airborne and can be transmitted through droplets. The family members that were at great risk from the disease are the aged and immunocompromised, as the book of basic virology states how the virus is capable of coming back periodically regardless of built immunity. And because of this, it also makes it difficult to control even with vaccination. And along with that, there's also antigenic drift and antigenic shift that causes variation of influenza and makes it increasingly hard to make vaccinations every epidemic. And for lacrosse encephalitis, which is case study 8, this virus falls under the genus Orthobunya virus, which is part of the family Bunyaviridae. Now, this negative sense RNA virus is usually associated with fever, rash, and encephalitis. Now, encephalitis is the swelling of the brain. The reason the physician had suspected the patient of having lacrosse encephalitis is due to the same symptoms that are presented, which is fever and the spinal tap, which confirmed it even more. The spinal tap revealed inflammatory cells, which is a clear indication of encephalitis. Another diagnosis that can be presented is influenza, as the symptoms are the same, with the exception being encephalitis. Now, the patient was likely infected through a vector, and usually the vector for this disease is a mosquito, like how you see right here in this slide. The transmission can be prevented by being very careful around the spring and summer seasons. This is where the vector usually likes to come out the most. Taking proper precaution before venturing outside, like using bug repellent products, and also maintaining proper hygiene as well. The local public health department can determine the prevalence of the virus by using mosquitoes as samples, as they can obtain and also test them for lacrosse encephalitis virus. Now, these are my references for that I used. I only used one. It was the book for the case studies, and that's it for me. Thank you for listening.
Hey, this is Arturo again, and I'll be doing case studies number 9 to 13. So to start, case study number 9, prions. So prions are known as subviral pathogens that are made up of proteins. They have no nucleic acid and replicate by infecting other proteins. Specifically, they use PRPSC, which is a protein that causes the misfolding of normal proteins. Prions are associated with affecting the brain and causing neurological disorders. And depending on the animal they infect can result in different disorders. Typically, Creutzfeldt-Jacobs disease is the one that is most prevalent in humans. It's been recorded that it accounts for 84% of all prion diseases related to humans. A special aspect of prions is that they can take up to 30 years before they show symptoms, and that CJD is typically seen only in older individuals. It is it is difficult to diagnose prions since their symptoms can look like other diseases, but when someone is suspected of having a prion disease, a Western blot test can be performed. In this case, a 70-year-old woman was suffering from headaches, behavioral changes, tremors, jerkings, and dementia. Then a little while later, she died. An autopsy showed that she had astrocytic glycolysis with fibril and intracellular vacuolation on the cerebral cortex. From her death, it seemed that prions were the suspected culprit. What makes this virus hard to diagnose is that they share many similar symptoms with other known disorders like Alzheimer's, frontal dementia, paraneoplasmic syndrome, and critical basal degradation. The features that pinpointed this woman's death as a prion disease is all the damage to her cerebral cortex. It is known that the prions cause severe damage to the brain. The symptoms that pinpointed a prion infection prior to her death, however, was the rapid dementia, the sudden changes in behavior, and her coma-like state. The abnormal electroencephalograph tracing from her also signified possible infections in the brain. When it comes to performing autopsies on individuals who have prion infections, special precautions are necessary. For example, covers all over the room where suspected fluids may land are required. Afterwards, all equipment used either needs to be burned or autoclaved before throwing away. For stuff that isn't thrown away, it requires to be soaked in hydrochloride. And when it comes to individuals' brains, and when it comes to the individual's brain, it needs to be soaked in 20% formalin for about 3 weeks to kill any infectious prions. Special precautions are taken because time and time again individuals get infected with prions by contaminated instruments at hospitals. Case study number 10, papillomavirus. So papillomavirus is under the family of Papillomaviridae. It is known to have an isocohedral capsid, and to replicate its DNA, it forces the host cell to enter the S phase of the cell cycle. But for the virus to even replicate, however, proteins called E6 and E7 are used to inactivate the host cell's P53 and P105 proteins. Without those host cell proteins, the virus can manipulate the host cell without risk of the cell inducing death. HPV is typically known to infect basement epithelial cells and mucous membranes. By the virus proliferating and differentiating, it causes the host cell to die, which in turn causes the symptoms of warts and tumors to appear on the skin. Tumors can sometimes lead to cancer, but not always with HPV. The HPV types that do cause cancer, however, are HPV 16, 18, 33, 41, and 45, with HPV 16 and 18 being the most widely known for cervical cancer. The other cancers associated with HPV are penile, oral, anal, and vulvar cancers. But usually cancers are rare with HPV infections. In this case, a 25-year-old was suffering from several hyperkeratotic papules that were located on their hand. It was noted that these warts caused little pain and never changed in size. They eventually went away after a year. It was given that the virus infecting this individual was HPV. People typically catch HPV through infect usually catch HPV infections through sexual interactions when another person's already infected. So typically you just need to make skin-to-skin contact with someone that has HPV to catch it. HPV isn't known to spread throughout the body, but if you touch an area that is infected, more likely or not, you'll get symptoms. For this individual specifically, HPV cleared up. Usually HPV infections are known to persist 12 to 24 months, and anything longer than that may indicate a persistent infection. So it's likely this individual cleared the infection and did not develop cancer since no other symptoms showed up after the year. To diagnose these types of infections, PCR tests are typically performed, and the samples they use are the infected skin cells that show either tumors or warts. So case study 11, adenovirus. So the specific adenovirus that affects humans is part of the Masodenovirus genus, and that genus is under the Adenoviridae family. Adenovirus is typically affects individuals by attaching itself to the nasopharynx of humans. When infecting a host, they produce three early genes that help inhibit and decrease the host immune response. E1 and E2 are proteins that inhibit P53 and P105RB. E3 reduces MHC proteins, and E4 lower the host T cell recognition. Adenovirus even has two types of replication. Type 1 has replication begin at one 3' site, while type 2 has it start at both 3' sites. Both lead to a large accumulation of single-stranded DNA that can be used to stop DNA replication, since since no discontinuous strand is present. When it comes to transcribing, adenovirus uses alternate splicing to attain a few late mRNA. Overall, adenovirus is known to be associated with different syndromes like pharyngitis and pneumonia. In this case, a 7-year-old boy was suffering from sore throat, headaches, cough, red eyes, drowsiness, and a fever. What makes this case special is that other children and even counselors who were attending the same summer camp developed similar symptoms. The symptoms were caused by adenovirus serum type 3. The suspected syndrome that was associated with these individual symptoms was pharyngitis. Why pharyngitis? Well, it's because their symptoms matched up with it perfectly. When when an adenovirus breakout gets this bad, there is usually a common source of infection, which in this example was the camp pond. It was possible that fecal-oral transmission or urine transmission was what passed this virus along to the people in the pond. What seemed to help the virus survive in the water and the GI tract of these individuals was its non-envelope form. Besides that, outbreak preventions for adenovirus is common, but in situations like this, where the source is a pond and not a pool, things like frequent hand washing and separation from sick individuals is about all you can do to help it. To detect the presence of adenovirus, typically PCR tests are performed. So for example, public agencies would use will use water samples and use PCR to detect the virus. And to diagnose it in individuals, they'll just use PCR from samples from the individual. So case study number 12, parvovirus. So parvovirus is a part of the parvovirus genus, which is in turn related to the Parvoviridae family. This genus is known to affect birds and people. When it does affect people, it is known to cause large amounts of red blood cell death. The infection of parvovirus B19 typically occurs in the blood and bone marrow. This virus attacks undifferentiated erythroid cells so they could perform replication. Their replication usually results in cytotoxic effects. Like some of the other viruses previously mentioned, parvovirus needs the host cell to be in S phase of the cell cycle before it could replicate its DNA. Parvovirus B19 is associated with transient aplastic crisis, pure red cell aplasia, hydrophilalis, and arrhythmia infectosum, which is associated with a slapcheek rash. Besides the last one, all of these illnesses are associated with developing anemia. In this case, a woman by the name of Mrs. Doe was suffering from joint pain and being lethargic, while her daughter was suffering from a rash on the face that looked like a slap. It was also noted that no other symptoms were present and that 2 weeks prior, the daughter had cold-like symptoms. The symptoms were caused by a parvovirus B19 infection. The key symptom that indicated a parvovirus B19 infection was the daughter's slap-cheeked rash and her cold-like symptoms from the 2 weeks prior. For the mother, her joint pain and unusual tiredness suggested the infection. The symptoms were more likely caused by the cytotoxic effects the virus has when in blood and bone marrow. Now, was the daughter contagious when she saw the pediatrician? No, since a rash indicates that the viremia of the virus had already passed. She was more likely contagious 2 weeks prior when she had the cold-like symptoms. Why the mother and daughter symptoms don't match up with each other is because parvovirus B19 infections cause different symptoms in different age groups. For example, in children, rashes and cold-like symptoms are common, but in adults, arthropathy and sluggishness is more common. What could make this type of infection more deadly is if one of them had a condition like anemia, sickle cell, uh, thalassemia, and even HIV. When this infection is mixed with these disorders, It can result in an aplastic crisis, which is life-threatening. When it comes to trying to quarantine individuals for this disease, it is difficult. It's difficult because noticeable symptoms of parvovirus B19 infections tend to only show after the contagious stage is over. Typically, the virus shows very generic symptoms that can be associated with something like a common cold when contagious. Case study number 13, herpes simplex virus. So herpes simplex virus is a part of the simplex genus, which is under the Herpes viridae family. There are three types of mRNAs that are important for this virus's replication. The three are alpha, which is responsible for intermediate early genes, beta, which is responsible for early genes, and gamma, which is responsible for late genes. But like many of the other, but like many other viruses, HSV requires the host cell's RNA pulse 3 for transcription. There are two widely known infections of HSV, which are HSV1 and HSV2. HSV1 is known for oral infections, and HSV2 is known for genital infections. Note that it is possible for both types to appear on each other's areas as well. Something special about HSV infections is that they can lay dormant in neurons of sensory ganglia. Overall, this virus is associated with infections of epithelium cells that are located in the mouth, genitals, eyes, and nose. It has also been reported that mothers can transmit this infection to their babies at birth via lesions they have. In this case, a 2-year-old child was suffering from pale ulcerations in the mouth, as well as red papules and blisters around the lip. It was noted that this child's condition worsened for a couple days until it completely healed after 2 weeks. The virus known to be infecting the child was an HSV1 infection. How diagnosis of this virus is performed, especially in this baby's case, was by serological tests. These kits are able to detect what type of antibodies are present during infection. There are alternative tests like PCR and viral culture. However, a serological test is not used. However, when a serological test is not used. Also, it is possible to determine the difference between HSV1 and HSV2 infections because each of them have separate glycoproteins. So when a serological test is done, different antibodies are present for the results. Specifically, in this case, the 2-year-old child was more likely infected with HSV1 since the symptoms were all located near the mouth. The immune response that is activated in HSV infections is typically interferons, innate immune cells like monocytes and neutrophils, and lastly, T cells like CD8 and CD4. What triggers the immune response is pattern recognition when host cells come into contact with infected cells. When it comes to the latency of the virus for the baby, it is more likely that the cells infected are the mucosal epithelial cells of the mouth. Something that can trigger reactivation of HSV is stress, sun exposure, fatigue, other infections, and illnesses. Typically anything that can lower the host's immune response. So the most likely way the child was infected was by the mom. It's possible that when the mom was contagious, she accidentally passed it to her baby. Reactivation of HSV can be asymptomatic at times. Two antiviral two antivirals typically used are aclovir and penicillin. Both are capable of being incorporated into the virus DNA chain during replication and triggering termination. Specifically for the baby, it didn't seem like any antivirals were used since it still took more than 2 weeks for her symptoms to go away.
Hello, my name is Corazon, and I will be doing a presentation on the following case studies 14 through 17, which are Epstein-Barr virus, smallpox virus, HIV, and hepatitis A and B. The Epstein virus is part of the herpes virus family, specifically under the gamma herpes viridae. It is a human herpes 4 virus gene, which its genus pertains to the cryptovirus. It is associated with human cancers. It is a double-stranded RNA virus. The types of ways this transmission happens from human to human contact is through saliva, sexual contact, blood transfusion, organ transplant. It is known to infect the following cells, which are B lymphocytes, fibroblasts, epithelial cells, and this pathogen leads to mononucleosis. Mononucleosis is the leading cause of swollen glands and fatigue. Furthermore, the Epstein virus affects the B lymphocytes as mentioned before. The symptoms that manifest in the patients when dealing with the Epstein-Barr virus are fatigue, fever, sore throat, headaches, body aches, rashes, swelling of liver, lymph nodes, specifically armpits and neck, and swelling of spleen. In this case study, there is a case of a 17-year-old high school student who has a low-grade fever and has had general discomfort for a lot of days. The student presents symptoms such as sore throat, swollen cervical lymph nodes, and increasing fatigue. They also notice the discomfort in the left upper quadrant of the abdomen. The sore throat, lymphadenopathy, and fever eventually went away on its own in the next 2 weeks. The patient does not recover their energy until another 6 weeks. In order to test for EBV, they must run these kinds of tests, which are monospot, early antigen, viral capsid antigen, EBV, nuclear antigen. To test for contagious mononucleosis, these are the following tests that must be run, which are EBV antibody testing, monospot, CMV testing, blood tests in order to check for antibodies, PCR. EBV and CMV may have a lot in common, but they are different from one another because of the symptoms that tell it apart. It is rare for mononucleosis for cases of Epstein-Barr virus being present. Glandular fever is responsible for the cause of fatigue and swollen glands. The ones at risk for contracting EBV are high school and college students. If it is not checked out on time, they can develop a chronic infection and fatal as well. This is why it is important to seek medical help, because this virus can truly be dangerous if it does get out of hand. In this case study, I will be discussing smallpox virus. Smallpox virus is part of the Poxviridae family, and its genus pertains to orthopox virus. One of the common ways to contract smallpox is through droplets. One of the few examples would be if someone that is infected with smallpox sneezes or coughs around an individual that is fairly close to them. Being around someone that has it can also increase the risk for smallpox. Not being vaccinated puts you at a high risk for catching smallpox One of the risks of smallpox is that it is easily contagious since it is airborne, which means that it passes through droplets. Many people have unfortunately died in the past because of this. The common symptoms for smallpox are high fever, headache, fatigue, and backache. In this case study, in the summer of 1971, a previous unreported outbreak of smallpox has occurred in Arlas, in the then Soviet Republic of Kazakhstan. In July 15, 1971, a biological research vessel called Levberg set sail from Arlarsk on an extended voyage. While the trip occurred, the ship stayed close to Denier Island, which happened to be a site of biological weapons field that has tested by the Soviet Ministry of Defense. The Levberg came within 15 kilometers of the island during a biological weapons test, which 400 grams of weaponized smallpox was released into the air. Later on, a patient became sick after arriving home in Aralask in August 12. She experienced symptoms such as fever, headache, and muscle aches. She was taken care of by her mother and visited by a local doctor who noticed that she had a fever of 35 degrees Celsius and a cough. The doctor gave her antibiotics and aspirin, but did not make a diagnosis at the current moment. Later on, a diffuse rash covered her entire body and eventually had a fever. She had been vaccinated against smallpox, as well as the other people in her family. On August 27, the patient's 9-year-old brother came across a fever and a rash. The pediatrician diagnosed him with hives, and the patient was treated with tetracycline, and he recovered within the next 2 weeks. When he was sick, the symptoms were the typical smallpox symptoms: a high temperature, along with a rash full of pus, which covered his whole body and is measured at 2 to 3 diameters. The rashes lasted about 2 weeks and then crusted over. The smallpox scars from the rashes eventually disappeared over a 2 years period of time. Over the next 3 weeks in Arlosk, the physicians saw additional patients, including the 6 adults and the 2 children. The 2 children that were not vaccinated against smallpox developed a hemorrhagic complications and passed away. One unvaccinated adult unfortunately died from the hemorrhagic variant to the disease. There are no known cases of smallpox in this current time. The virus had been eradicated for many years. Unless there were to be some unusual case of someone not getting vaccinated, and the situation would eventually get out of hand in that population where the individual is at. Smallpox has presented with a high death rate in the past, with about 30% before the vaccines and medical advances were made. Old methods of protection for smallpox were material exposed to the smallpox and rubbed onto the person's skin. This resulted in less people dying from this. I think that it was a great strategy. I think it was a great strategy if I were to be in that type of situation during those times in terms of controlling this type of disease, to at least have some sort of compromising immunity. In this case study, I will be discussing HIV. HIV is part of the Retroviride family genus that pertains to the lentivirus. It is a single-stranded RNA virus. HIV is contracted by needles being shared most of the time when drugs are being consumed. On rare occasions, blood transfusion, kissing of mouth if the individuals happen to have sores open, unprotected sex. Cells that are affected by HIV are the CD4 cells, which are the white blood cells. The symptoms for HIV are fever, chills, night sweats, rash, muscle ache, sore throat, fatigue, and swollen lymph nodes. In this case study, a 28-year-old man had many concerns. He had came across symptoms of thrush, which is oral candidiasis, and a low fever. And he had serious diarrhea as well. He had lost 20 pounds in the past year without partaking in any diets. And he complained a lot about having difficulty breathing. His lungs presented a bilateral infiltrate on the radiographic examination taken. The characteristics of pneumocystis jirovecii pneumonia. A stool sample that was collected from him tested positive for Giardia organisms. He happened to be a heroin addict and admitted to sharing needles at a so-called shooting gallery. The types of tests available for HIV are nucleic acid tests, antibody testing, antigen tests. The patient had contracted this virus through sharing of needles when he was doing heroin, and perhaps through unprotected sex as well. CD4 cells being affected increased his vulnerability to testing positive for Giardia organisms, since Giardia are opportunistic parasites. The safest way to handle HIV samples when working in the medical field is by wearing gloves during the procedure and throwing them away when they're not in use, washing hands before and after, Being cautious of handling needles when taking samples of the patient. It is not recommended to break the needles in half or put the cap back on. It is best to just throw away the needles in the designated sharp containers. The potential HIV components that are being used are harmless vectors of HIV virus, protein of HIV from its surface. I would say the appropriate individuals for HIV vaccine testing could be members of the LGBTQ community, since they are at a high risk, as well as the Black and Latino community. In this case study, I will be talking about hepatitis A and B. Hepatitis A is part of the picornavirus family. Its genus belongs to Heptovirus. It is double-stranded DNA virus. The symptoms for hepatitis A are fatigue, nausea, abdominal pain, loss of appetite, and low fever. Hepatitis B is part of the Hepnavirus family genus. It belongs to the orthohepnavirus. It is partially double-stranded. In order to contract hepatitis A, one must have consumed food or drinks that was contaminated with hepatitis A. In order for that to have happened, the person that was preparing the foods or drinks must have had hepatitis A. Human-to-human interaction, meaning, for example, if you live with someone that has hepatitis A, most likely you will catch hepatitis A, or if you're close to somebody in terms of being a close proximity to someone, you will catch hepatitis A, unfortunately. It is passed through fecal through oral transmission as well. When contracting hepatitis B, it can be passed from mother to child. Sexual contact with infected person that has hepatitis B can very much happen as well. Needles being shared, sharing personal items such as clothes possibly, and having contact with the infected person's open wound and /sore. Symptoms for hepatitis B are yellow eyes, abdominal pain, dark urine. Some people, specifically children, don't really have any symptoms. In this case study, a 55-year-old man, which is patient A, went to the hospital with fatigue, nausea, abdominal pains, and discomfort. He also presented himself with a slight fever and had very dark yellow urine. His stomach was feeling tender. He had recently came from Thailand within the last month. Another patient, which is patient B, was allowed in the hospital because she was complaining of the following symptoms that she was encountering, which were vomiting, abdominal pain / discomfort, nausea, anorexia, dark urine, and jaundice. She later on admitted that she was a former heroin addict and she would share needles as well. And she was also 3 months pregnant. Furthermore, after observing both of their cases. We can confirm that they very much do have hepatitis. Both pathogens attack the liver cells. The symptoms that had manifested within the patients were helpful indicators towards leading for their diagnosis. The antibody testing for hepatitis are for hepatitis, in order to tell hepatitis A and B apart, would be for hepatitis A, IgM anti-HAV hepatitis test being used, and for hepatitis B, IgM anti-HBC and HBsAg, meaning that once the individual's blood sample is collected, it is best to test the blood within those kinds of tests and see which one tests positive and which one would test negative for those kinds of categories. Patient A definitely got hepatitis through traveling, and patient B was definitely contracted hepatitis through sharing needles. Patient A should have been taking more precautions when traveling, as well as the interactions he had made with people, meaning that he should have been cautious with who he was around, if he shared any drinks, the place he was staying, and how sanitary was the place, and the food places that he consumed, especially if it was street food. As for patient B, she should not have been sharing needles with others, especially because she is pregnant. Out of those two patients, patient B is the most vulnerable for chronic disease since she is pregnant, and anyone that is pregnant is always at a high risk for any kinds of diseases. That is the end of my presentation.